I'm going to briefly talk to you about healthcare. Healthcare cost keeps going up, and now they are looking forward to a universal healthcare. Government can't solve all the problems in healthcare. This is as a physician, as I've been in the healthcare for the last 40 years, and I'm telling you, you know who can solve the healthcare? It's you as a consumer. You as a consumer. Ron Bachman, my mentor, he believes in you. Consumer-driven healthcare, folks. Consumers have the power. Consumers have the power to lower the cost of this healthcare in this country. It doesn't take a genius, folks. It's very simple. If you're an individual, you can contribute. You're unmarried, contribute $30 I'm talking about $10 a day, $300 a month. If you're married, $20 a day, $600 a month, if you can afford it. If you can afford that, contribute to a health savings. Once you lower your premium, insurance premium, by getting a deductible health plan, you qualify for health savings accounts. Once you have the health savings accounts, you're in charge. That money is diversified into an equity or into a Schwab account. It will appreciate like any other pension plan, IRA, you name it. Once you are in the driver's seat of healthcare, few things I would like to see it happen, folks. I believe in Ronald Reagan. As Ronald Reagan did in 1980s, he deregulated the healthcare industry, airline industry. Consumers, believe me, prices dropped like you will have never seen. I was really shocked when I saw the airline prices dropping so much after deregulating the airlines. That's what we need in healthcare. Healthcare is the most overregulated industry we have come across. I don't know why the government wants to regulate so much, and it's costing all of us. It's not affordable, folks. It's not affordable. Once you deregulate, the prices will drop. And you know what consumers will demand? You'll be surprised what consumers demand. They want affordability for all of us, not just a few. They want affordability to all Americans, not just a few. And they want competition among the providers, not consolidation. These managed care companies are literally destroyed the healthcare industry. They're the one who's making money. Get rid of all these managed care organizations. They literally are raising the cost because they are pocketing. In addition to the insurers, managed companies it's subcontracted to the managed care. What insurers are doing is subcontracted to the managed care organization, and they're raising the administrative costs, and we are paying for it. Yes, we are paying for it. Get rid of the managed care organizations and bring competition among the providers. It's so important to have doctors love competition. Believe me, when I started my practice in 1980s, competition. I loved the competition. They're not afraid of competition. Doctors, the way they are trained, they want to compete. They want to be the best. As a physician, they love to be the best. And the other thing, folks, transparency. We need more transparency in healthcare than anywhere else. Any other, you name it, folks. Any other, we need transparency, not price fixing. This is what is happening. Price fixing is raising the costs, and this, whatever the CPT and DRG codes started by the government, it's not helping us. They are fixing the prices based on the DRG and CPT codes. They're for the birds, man. Let consumers demand what they need. Folks, If you really, if all of you have done the research, I want you to be aware of this. I'm not kidding. This is reality. 1/3 of the illnesses are psychosomatic. Psychosomatic. You don't need to see a doctor. You can just be in front of a Watson computers. He will analyze what's your psychosomatic illness, and the technology is out there to solve your psychosomatic. You don't need a healthcare professional for that. And 2/3 of the illnesses, what we have, you don't need to visit the doctor. Telehealth and AI is going to resolve almost all the issues what we need. So what I'm trying to say, technology is on the favor of consumer side. Technology and AI is in the favor of the consumers. This healthcare is going to be seeing a lot of changes, folks. That's why I started these nonprofit organizations. Why did I start nonprofit organizations? You might ask me, why did I do that? Because being a physician is one thing, but being a patient is a different ballgame, man. I'm a runner. I've been a runner all my life. For the last 30 years, I've been in marathons. I ran 6 miles every day, but I didn't know that runners get coronary artery disease. So one day, I was on a treadmill. I was having a little discomfort in the chest. I went to my son. I said, hey, I'm having this discomfort. Dad, it's easy. We'll just go ahead and put some dye and check your vessels and see if there's a blockage. I thought it was a great idea. Simple outpatient 23-hour procedure. You wouldn't believe it. These hospitals bill me for $227,000, folks. I had no idea how much they were billing my insurance. You know what? The Medicare, even stupid Medicare, paid $35,000. And my private insurance, whatever supplement, they collected $60,000 for a $15,000 procedure. That ticked me off. I decided I have to be, somehow I need to do something. Then I started this nonprofit because I was taking care of the senior folks under Foremost organization. Now renamed it as a DollarCare because it makes sense. Every dollar you spend on your health, it is important. You need to save every penny. You need to be empowered. You need to be enriched. Nobody else. Insurance companies first of all, insurance companies, they have to start doing a risk segmentation. You know, they don't do risk segmentation. Insurers don't want to do risk segmentation because the premium have to be based on your health, not by your age. Oh, if you're 50 years, $600, $700. If you're 55, $800. You're 60, $900, $1,200. This is the way it's going, man. This is what it is. No matter how healthy you are, these insurers are driving up the cost. You know what? Who is the behemoth organization among the insurance? You'll be surprised. United Healthcare is a behemoth organization. They just want to take over the entire healthcare. Home care, they literally swallowed all the healthcare, home care agencies. They want to take over the entire healthcare. They're gobbling up. Folks, wake up, America. Wake up, America. Let's make you in charge as a consumer, as an American. You have the power to lower the costs of the healthcare. It takes fitness, not fatness. Right now, all the Americans are getting fatty because they don't care about their health because somebody is giving a free care. Once you know you have money in your savings account, believe me, folks, you watch everything what you eat. That makes you focus on your health. We need health savings account so bad. And I was lucky enough to put money aside in 2004 when they passed the legislation. I covered for 8 years and I invested in health savings. Now I have 200 grand, which is good. It's better than nothing. I don't want a penny of it. I don't want to spend a penny of my health savings. You know why? I want to give it to my kids, my grandkids. This is the way human nature is. They want to save every penny. Give the power back to the people, man. Why is the government want to regulate the healthcare? I don't understand. Where over-regulation is killing us. It costs $20,000 a day. Who can afford $20,000 a day for a bed, hospital bed? Does it make sense to you guys? I used to have my own outpatient surgery center, and they came after me. They just they took away. I didn't care. Whatever they did, I don't care. But what I did is I started something like a alternative short-term stay facilities. In 1995, these managed care companies came in. They destroyed the whole American alternative hospital franchise. I spent $500,000. Basically, managed care organizations took care of it. They basically took over the entire healthcare. Now I'm looking at an opportunity where, after I read Ron Bachman's book on consumer-driven personalized healthcare, believe me, folks, time has come. Let's bring Ron Bachman back in front of the Congress. Deregulate the healthcare industry. Deregulate the healthcare industry. And encourage short-term facilities. You don't need, big, huge institutions, because $20,000 a day hospital bed is too much. If the consumer takes control, believe me, folks, that's going to drop. That's going to drop. So I hope I'm making sense to you guys, but I want you to get rich, not insurers, not middlemen, not billing companies, and get rid of all this coding, CPT and DRG codes. Get rid of them. Let consumer pay how much you want to afford to pay. Why do we need CPT codes, DRG codes? It makes no sense whatsoever. These are all government manipulated spice hikes. And now they want a universal health care, for God's sake. Government want to run our lives? It's going to happen. It's not going to happen, folks. Being in America for the last 45 years, I'm telling you, America will never go for socialized healthcare, socialized medicine. It failed everywhere in England, Canada, all Europe. You know who has the best healthcare system right now? Switzerland and Singapore. Singapore has the best healthcare system. And America and Switzerland also has the same consumer-driven healthcare. Folks, we really need to, time has come to take over and stop this. What Obama did to the healthcare, I'm so disappointed with Obama because I believed in him. I thought he was going to help the black people. Me being a black, I voted for him. I was so disappointed. He didn't help the blacks. He didn't help anybody other than his oratory skills. He is good. He's a man. He's a good talker. But what he did, he basically empowered the insurers. And he made sure if there's a pre-existing illnesses, the insurance companies don't deny. That's all he did. Pre-existing conditions, when they get denied, you know what? I can do the same thing under the Health Review Authority. DollarCare would like to have a public-private partnership with any company, any big corporations like Google, Microsoft, Tesla. It doesn't matter. Facebook. I can collaborate with any private company DollarCare organization is a public organization. We want to help the people who can't afford the health care. There are a lot of folks out there, they have no home. They're homeless and sitting on the street, and they are mentally challenged. Who's helping them? And these politicians want to give away free care. How? We have no money. We have no money. What I would like to see, as Ron Bachman has said, there has to be health review authority in place of Health and Human Services, bonkers. Just get rid of that agency. Health and Human Services is bonkers. Health Review Authority goal is to protect the people who can't afford the health care. If there's a pre-existing condition, if insurance company denies it, you as a health review authority, you take upper hand and try to tell the insurers, you can't do that, because once insurance companies are tagged, their business will go down. So this is what is going to happen. If they deny a qualified applicant, they need to be punished. They need to be penalized. And in that process, they will be careful in denying a pre-existing condition. And I would like to see Health Review Authority give a certificate of guaranteed coverage. It's like a private doctor. You can go to any private doctor in the country. Not stupid Medicare, Medi-Cal, Medicaid. It's a government card. Nobody wants it. You know, guys, I should tell you, I used to take care of the Medi-Cal patients. I have seen lots of Medi-Cal patients. One time, I billed for 20 or 30 patients. You wouldn't believe it. Medi-Cal reviewed all my billings. They sent me a bill for 1 cent. I wish I kept that check. They had the audacity to send me a bill for 1 cent. Why? Why did they even bother to send a 1 cent check? That's what the government works. That's what these regulations do. This government can't solve all the problems. We as Americans have a responsibility to help and serve this country. As John F. Kennedy said, ask not what a country can do for you, ask what you can do for the country. I admire John F. Kennedy. He's my favorite president. And then came Ronald Reagan. Wow, what a change. What a change. I've never seen anyone like these presidential figures. Right now, I'm disappointed with everyone, especially Obama. Actually, Bill Clinton did fairly well. I commend for his presidency, but rest of them all, even all these politicians, George Bush, everybody, they literally didn't do a damn thing to this country other than spending more money, borrowing more money, creating deficits. We need another John F. Kennedy or Ronald Reagan. Yes. I would like to see the day this country wakes up and gets Americans to be in the driver's seat of healthcare. Time has come, folks. Time has come. Americans will solve the healthcare puzzle once for all. I really believe in people. I really believe in people, not the government. You know, they're bringing more illegals into this country. You know, one party wants the people to be poor so they can harvest their ballots. This is the way it is going, man. Who cares about wokeism, sexism? And this abortion is a gimmick, folks. They're killing the babies. I understand. I'm a Hindu. I have nothing against people having an abortion. What I'm saying is, as a Hindu, I believe if the babies are being killed at 8 months or 9 months, as a human, I detest that. I detest when they start killing the babies. Maybe, 18 weeks, if it was incest, if there's something mother wants to have the abortion done, that's different. We're not talking about that. We are talking about women's rights is a man's right. What are they talking about? Women's right is the woman have the same rights anybody else. If they want to have a baby aborted before 12 weeks, go for it. Take a pill. But don't kill the babies, man. At the age of 30 weeks, 36 weeks, you're killing the babies. Just, we love our animals. What are we doing to the babies? It's just, I just can't. Humans love animals. I've seen in Long Beach, everybody has a pet. Baby, you're talking about a baby. At 30 weeks, you want to kill that baby? What kind of a human are you? I don't know. But anyway, coming back to the healthcare, folks, DollarCare is on your side. I want Americans to be aware we need to bring public-private partnership. I'm looking forward to working with anyone, and if we can bring common sense to the healthcare, I would love that. I would love that. Again, I don't want to be political here, but transparency is critical. I think Donald Trump tried to bring transparency to the forefront, but then he lost his president, in the elections he lost. But if you would have been there, I'm sure there would have been a transparency in healthcare. He was trying to make changes in the healthcare, but he didn't get a chance to do it. Now is the time, folks. You guys decide whatever you want to do, but don't look for handouts, please. Don't look for handouts. Be empowered. There are people out there can help you. But if you're mentally challenged, yes. But there's a way to do it, folks. Let's be aware and take control in ourselves and follow the dream. I've been a dreamer all my life. Coming from India, the poorest country on earth, I love the freedom. I love the freedom. And we need to be not only be free, we need to be free from the government overreach. This is what is happening. Folks, if you like what I'm saying, follow me under the DollarCare. I have a YouTube channel, DollarCare. I'm on the Facebook. I've written books on Medicare overhaul. I've worked on cash care. I've written a book on cash care. Consumers Doctor. I have written a few books, but my focus is always been on healthcare. Let's do it, folks. Let's do it. Join me. Join me. Thank you for listening. Goodbye and salute.